years I've had knee surgery, hip surgery, back-related issues, shoulder issues. I've been seeing VJ for about 10 years plus. What I'm here to see him for is a general checkup and to talk about where I am physically.
Hey Jim, how are you?
Dr. Bott, I'm very well, thanks.
You lost a lot of weight. Where was your weight before we started and where is it now?
I think my weight was roughly around 240, and right now, as of this morning, because it was my weekly weigh-in, it was 208.
Wow.
Yeah.
32 less pounds of you to love.
Here is a guy who his whole life, at least for the last 10, 15 years, has been at least 30 to 40 pounds overweight. And as a result of that, his back, and to a smaller extent his knee, they've taken a beating.
One of the things that happens when you're dealing with a practitioner like VJ is, in a sense, he almost is like a general practitioner for your orthopedic life. So in my case, one of the big issues is quality of life and also maintenance of that quality of life. You know, over the course of the last year, my insulin levels dropped from 8 to like 5, and I remember our first conversation on it.
Yeah, I mean the thing is, every time I say to people, it's insulin resistance makes it hard to lose weight, they think of, just diabetes, and people don't realize that vast majority of the people who are insulin resistant are not diabetics. It's the extreme end who are diabetics, but I mean you're not a diabetic by far the stretch of imagination, but you were insulin resistant and you're much less now.
This is a guy who was very insulin resistant. Remember, vast majority of the people who are insulin resistant are not diabetics, although the extreme form of insulin resistance is diabetic. So your average diabetic actually has too much insulin, but the insulin sensors don't recognize it at it being around, so the blood sugar does not get driven into the cells, it stays in the bloodstream.
Now, did you do anything in the diet to try to reduce that insulin also, like the avocados and...
Avocado, and also just, I think, also eating protein consistently in smaller meals, and sometimes recording what I eat when I want to get a better handle on it, but trying to be smart about the amount of carbohydrates I ingest and other
and a lot of fresh berries.
I love my blueberries, VJ. You can't really do much about chronic pain and chronic conditions, but you can manage how you deal with them in the present.
The basic first step in treating arthritis is eating the right type of food. So we've altered his diet to cut out all the processed stuff, eat more fresh vegetables, more berries, more soy, more avocado. The next step is take proper supplements, and in his case, he takes fish oil, which is good for arthritis. He also takes glucosamine and chondroitin, which have very good data on slowing down progression of arthritis in the knee at least. And most importantly, he has really focused on weight loss.
Over time, VJ and I have worked on has helped me a great deal with overall strategies towards quality of life and general fitness and health overall.
Let's just review what I think the 2 exercises you should be doing just for to maintain the core as much as possible. I mean, you know how to do a single leg stand. You stand on one leg and you just do basically this. Minimum 3 to 5 sets of 10. So what you're doing here is you're building the balance, and you're also really strengthening these what I call the hip abductors that are very important in core stability. So do you want to just practice that? I just want to make sure you're doing it right. So put your arms out like this, stand on one leg, and just perfect.
I think my sneakers are going to fall off right now. But
so it's that exercise, and the second one for you is the plank, which would be ideal. If you're traveling or something, you have very little time to do the whole thing. You could just do basically these 2: the single leg kick, 3 to 5 sets of 10, and then 1 to 2 minutes of a plank. You know how to do a plank? Elbows, toes, and bring the body up.
like that?
Yeah, let me just take the pillow off and move all the way up.
Yeah, sir.
There you go. Elbows, toes. So that's perfect. Start out with 1 minute and work your way up to about 2 minutes. So you're firing every core group here, really, this being the entire core. From the back and the front, he's firing the whole core. This is what I call all systems go in This is a great exercise. 1 to 2 minutes every day is really great core conditioning exercise. Okay?
I've never probably felt physically better than during the course of the last 365 days. In some ways, for someone who's 47, having to deal with these issues keeps me, if I want to have positive quality of life, I have to keep myself in really good shape, relatively. And I think, the benefits of that speak for themselves.
Okay, so let me see you back in about 2 months for a revisit and see how things are coming along.
All right, done deal.
Okay?
Thanks. Good to see you, Dr. Vaz.
Nice seeing you, Jim.